Good afternoon, everyone. I'm Dr. Simran HUNDLANI, and I'll be talking about correlation between Munk score, tear film height that was measured using slit lamp examination, and tear meniscus height, which was measured using an anterior segment optical coherence tomography. So, epiphora and dry eye account for the most common complaints of patients presenting to an ophthalmology clinic, and around 8% of all these cases of epiphora occur due to punctal stenosis. So, it is very important to measure the tear film, which can be done by various methods such as Munk score, or the newer emerged method is doing an anterior segment optical coherence tomography. So our study was basically devised to evaluate the correlation between Munk score, which basically grades epiphora according to the patient's complaints, and measuring tear film height using a slit lamp biomicroscope, and also measuring the tear meniscus height using an anterior segment optical coherence tomography. It was a prospective observational study with 38 clinically diagnosed eyes with punctal stenosis with complaints of epiphora were taken into consideration, and any patients with causes of epiphora other than punctal stenosis were excluded from the study. So it was a pretty simple procedure in which first an informed consent was taken. Thereafter, a mini Monoka stenting procedure was performed, for which the punctum was first dilated using a Nettleship's punctal dilator, and an adequately sized mini Monoka stent was placed in the lacrimal punctum. Thereafter, the stent was removed at the end of 4 weeks for all these patients. So the various parameters as just discussed were measured at 4 visits pre-procedure, and 1 week after stenting, and third visit was 4 weeks after stenting, and the fourth visit was at 8 weeks after the stenting procedure. So here it is very important to note how exactly was the tear meniscus height measured. So this was measured using the Topcon DRI-OCT1 model, which is a swept source AIOS2025 model available in our hospital. Then with the eye in primary position, a vertical line scan was taken passing through the center of the cornea to measure the tear meniscus height, and this was the image that was obtained, which was then measured using a scale. The data analysis was done using a student's paired t-test and Wilcoxon signed rank sum test, and a p-value of less than 0.05 was considered to be statistically significant. The results obtained were as follows. The mean age was found to be around 54 years, and 31 of the eyes were those of females, whereas 7 of the eyes were those of males. So the Munk score showed a progressive decrease from the first visit to the fourth visit, which was found to be statistically significant. The tear film height, which was measured using a slit lamp biomicroscope, also showed a progressive decrease, which was also statistically significant. And the same was found for tear meniscus height that was measured using an anterior segment optical coherence tomography. There was a significant drop from the first to the third visit, and it remained nearly constant from the third to the fourth visit. So this is the graphical correlation between Munk score, tear film height measured using slit lamp examination, and tear meniscus height measured using an AIOS2025. And all these values were found to be statistically significant using the various correlation coefficients as well. So there are very limited options that are available to accurately measure the tear meniscus height, and most of the studies done earlier used a video dacryomeniscometry, which is a very complex method that involves a software and numerical data conversion. So therefore, the newer and quickest available method now is doing an anterior segment optical coherence tomography, which was earlier done by Singh et al. And they also found significant correlation between the third and the fourth grades of Munk score and TMH measured by AIOS2025. Nugent et al. Also found a similar correlation. However, this was done in patients with dry eye. Thus, our study also confirms the same, and therefore, I would like to conclude that Munk score serves as a valuable clinical marker for both tear film height and tear meniscus height, thus establishing a very important quantitative and qualitative relationship. Furthermore, it gives an accurate assessment of the tear film by using a swept source AIOS2025 model, and can further aid in future treatment approaches and provide prognostic information at the same time. Thank you.
One thing which I want to ask you is that you had 38 patients of punctal stenosis.
Yes, ma'am.
And in all 38, you could just do a punctum dilatation and put a mini Venoca in stenosed punctums.
Ma'am, this was actually...
Very unlikely.
No, ma'am, this was actually a part of a larger study which was done for punctal stenosis and to assess the correlation of mini Monoka stent and how it affects the punctal parameters. And this was one of the correlations that was found in that study. So it was basically done only for patients in which mini Monoka stenting procedure was performed.
Mini Manoka तो आप करोगे, but punctal stenosis just does not get relieved by a simple punctum dilatation. So many times you have to do a three
snip
snip procedure,
procedure.
and so you haven't mentioned anything about the snip. You didn't come across any patient who needed a snip procedure.
No, ma'am. The study was done only in patients who underwent mini Monoka stenting procedure, and we
So you
preferably
excluded them.
You included
Yes,
these
ma'am.
patients also.
Yes, ma'am.
And all the way acquired ones, no? Not,
Yes, ma'am.
acquired.
Yes, ma'am.
And how long was the history of their
Irrespective of the duration of epiphora, ma'am, all patients with punctal stenosis who underwent mini Monoka stenting were considered in the study.
But duration has a significance. The more the duration, the more
More
the
the
chances of
stenosis.
canalicular stenosis is also
yeah.
there.
Generally, we take when we do such studies, we prefer 1 year or
So
2
you
years.
have taken all good patients.
So can you simplify your conclusion? What were you trying to prove with this study? Fine.
So we're basically trying to prove that tear meniscus height can be measured more accurately using a more objective method, which is an OCT model. So we can actually measure exactly as to how much is the height, and also like as a part of the larger study, we also found that okay, this is the tear meniscus height. If found above this value, we can go ahead and do a mini Monoka stenting procedure. This is what the future prognosis can also be explained.
ज़्यादा sense बनी नहीं है. चलो, thank you.
Yeah, thank
Thank
you,
you
ma'am.
so much.